Misinformation is inaccurate or misleading information. And actually we see misinformation occurs in all kinds of contexts. So you might have seen it in relation to politics, the news, finance and health. In the context of all of these settings, really misinformation is important because of the way that you might do something as a result of that information, how you might act on it. And the context of mental health, that's really important. We know that many people will experience mental health challenges. I think the stats are something like 1 in 4. And we know that increasingly young people are turning to social media where they might seek DIY help for their mental health challenges. I think there's something like 1 in 3 young people will do that. The really big challenge is that actually the quality of the information that they might encounter in that space is really mixed. So there might be good and helpful information there, but there might be information that's misleading or inaccurate in some way too. So I've been leading a piece of research at the University of Birmingham. It's a collaboration between the Universities of Birmingham, the University of Nottingham, Aston University and the McPin Foundation. And we're also really grateful to have Care for the Family as partners on that project too. This project came about because we talked to young people and we said, what's important to you about your mental health and social media? And they told us that influencers were really important to them. So influencers are these internet personalities that gather large online following. And they talk about mental health in all kinds of different ways. It's a really underregulated context, and so we don't really know very much about the quality of what influencers share about mental health, and we don't really know what young people do with that content. So this project has been all about mapping out what influencers talk about in terms of mental health, and it's been about listening to lots of young people and understanding how they use that content or how they don't, and what that implication has for them and their well-being. So there are 3 ways that we really see misinformation working in terms of mental health content particularly. Firstly, we can see the way that everyday terms for experiences that you and I might have, like anxiety or depression, those terms can also be used about medical diagnosed conditions as well. In terms of social media content, that blurring between the everyday and the medical or the diagnosed or the therapeutic terminology can be really tricky. So for example, you might see anxiety being used to describe social anxiety as a diagnosed condition, or it might be used to describe that feeling when you've had too much coffee first thing in the morning. And teasing those 2 things apart is really important. A more specific example might be OCD, for example, which is a very specific diagnosable condition, but some people might use it, for example, for tidying their fridge. And that's really misrepresentative and really can be quite hurtful and unhelpful for people who do have that kind of condition that they are navigating. So the second way that we see misinformation work with mental health is where you have a particular, really quite specific set of information. It might be about a treatment or a diagnosis or a condition. And actually that's represented in a way that's both oversimplified and overgeneralized. So for example, you might see this in a 5 signs of a, or how to spot a narcissist or something like that. And it can be really easy in those kinds of settings to see that kind of very simplified representation and apply it in a way that's misrepresentative. So for example, if we take that example of how to spot a narcissist, well, if you're talking about a personality issue or challenge that's going to be diagnosed by somebody like a psychiatrist or a psychologist, that's going to take some time. It can't be done in a 30-second video that you just watch. And the third area where we see misinformation really proliferating in relation to mental health is in terms of the solutions that are presented. Very often in influencer culture, it's about recommending a self-help solution. So this might be a supplement that somebody can buy or some kind of product or some kind of service that somebody can take and use on their own, perhaps without medical or professional supervision. The real challenge here is that when misinformation is at work, there may not be accurate information that's given. It may not be somebody who's got the right qualifications to give that advice. It may not be that the advice is helpful at all. There may not be evidence to support it. And that can be tricky because often the way that that is presented is that it might have scientific sounding language wrapped around it. It might use technical terms like neurotransmitters or energy, or talk about some kind of pseudoscientific effect, promising results, but without any evidence to actually support that, except perhaps for the person's own personal experience. They might even mention some kind of study, but not actually point you to the study so that you can check it out for yourself.